Alrighty, welcome back. Well, March is Bleeding Disorders Awareness Month, and there are many types of bleeding disorders, and it's possible some people who might have it and not even know it. Now, to tell us more about it, we have from C4K's Foundation, Dr. Aimee Foord. So thank you so much for being here.
Thank you for having me.
Of course. All right, so help us understand a bleeding disorder and maybe some of the symptoms that someone might experience.
Exactly, that's a great question. So there's lots of things, proteins, enzymes, factors in our body that help us stop bleeding. And if one of those levels are low, or if one of them aren't working correctly, that can cause bleeding symptoms. Bleeding symptoms are a multitude of different things. So one of them is if you have nosebleeds for longer than 10 minutes, that's kind of a little red flag that you should bring up during a well check.
Okay.
For females that have periods, I use the 7-2-1 rule, and that was published by the Foundation for Women and Girls with Bleeding Disorders Foundation. 7 meaning if your period lasts longer than 7 days. 2 meaning if you're changing your pad or tampon more frequently than every 2 hours. Or 1 if you're passing clots bigger than the size of 1 inch or roughly the size of a quarter. Those are all things that you should bring up to your doctor. You should also know your family history, whether there's a family history of bleeding, or if you have a personal or family history of bleeding after childbirth or bleeding after surgeries that's prolonged or unexpected.
Okay. All right. And you guys also have something called a comprehensive clinic for patients that are dealing with blood disorders. So talk about that.
So a comprehensive clinic is where not only you see me, but you see a multitude of providers. So patients with bleeding disorders, studies have shown that if you have a disease or a disorder that can affect multiple aspects of your life, those patients do better if they're approached in a comprehensive sort of manner. So in our clinic at C4K's, in our comprehensive clinic, you see me, you have labs drawn, but you'll also see my RN coordinator that goes over all your symptoms and your concerns. You'll see our pharmacist who goes over all the medicines you're prescribed and how to store them, how to travel with them. You'll see our physical therapist that goes over full body like joint exam and muscle exam to make sure bleeding's not affecting those things. And then you'll see our social worker to make sure that we're focusing and supporting you financially, education, with school and emotional support and mental support. And then you also see one of our Roseman dentists to screen for how to do dental health with a bleeding disorder.
And is it possible for someone to have a bleeding disorder and not even know it?
Absolutely. So a lot of my patients I inherit, especially when I diagnose a kid with a bleeding disorder, their parent could have the same one. So some bleeding disorders are inherited and genetic, some are just acquired, and that's why it's really important to have regular visits with your pediatrician or your primary care provider to ask these questions and to screen whether you need a referral to a pediatric hematologist like myself.
Wonderful. And real quick, is there a cure or is this lifelong?
So, like I said before, some are genetic and you're born with it and you'll have it forever. Some are acquired and can be treated and go away. So it depends on what defect you have, whether there's a cure. What's really exciting is something called gene therapy that was just approved by the FDA for hemophilia adults in early 2023. That's where you actually have a new gene injected into you to replace what's missing. And that's a new cure that we have for hemophilia. So if you would have asked me this 3 years ago, I would have said no. There's a lot of supportive care and a lot of options for medicines at home or infusions. But now we actually do have a cure, which is very, very exciting.
Wonderful. Definitely very exciting. Well, Dr. Foord, thank you so much. And if you would like more information, go to C4K's.org. And Studio 5 Live will be right back.